The chance for another surge in California is real.
The virus.
We have to address the variants.
The impacts.
We are running quickly out of space.
No joke. It's literally no joke. It's truly a war zone because you're always on the go.
It's been crazy for this whole past year.
At the end of the day, everybody has bills.
Back in March, we didn't even anticipate having vaccines today.
And now, the race to vaccinate millions.
If I were to design a perfect world, get most of our vulnerable population vaccinated.
It'd be hard to put into words how inspiring it is and how grateful it is to be part of it.
I don't think there's a soul in there who isn't happy today.
If I can get vaccinated, other people can get vaccinated, the community can get vaccinated, and the end is in sight for this pandemic.
This is a KCRA 3 News Special. Coronavirus, now and next.
Good evening to our KCRA viewers and our KSBW viewers now joining us on the Central Coast. Tonight, California is at a turning point in the coronavirus pandemic. Cases and hospitalizations are trending down, vaccinations are picking up, but still, nearly a year after the initial restrictions, we have a lot of questions.
Yeah, new variants of the virus are being found across the state, and January, the deadliest month for COVID in California, and we still don't really know the long-term physical impacts of this virus and the mental toll being felt by so many of us right now. Well, tonight we're going to try and talk you through what is happening right now and what's expected to happen in the coming weeks and months.
So far, more than 3.3 million Californians have tested positive for COVID-19, but this is encouraging. We are seeing a decline in new positive test results and hospitalizations over the past month.
At the same time, California also just recorded its deadliest month of the pandemic, and there are those new variants of the virus we've been hearing about, mutations that worry many of the medical experts. And for millions of people, that adds urgency to some basic questions. When and where and how can I get a vaccine?
It has been hard to figure out. Well, there are 2 vaccines approved in our country right now, and Johnson & Johnson is formally seeking approval for its vaccine. That was just announced today. But the demand for them far outpaces the supply, and the logistical challenges of distributing and administering the vaccine can make anyone's head spin. So we're going to walk you through what we know at this moment and what you can expect to happen in the coming weeks.
So let's start off with eligibility. And right now, counties are deciding on who is eligible for the vaccine based off of the state's guidelines. And as you know, it changes by county depending on how many doses they have and who they've already vaccinated. So that means what Sacramento County is doing is different than what San Joaquin County is doing and far different than what Stanislaus County is doing. And with that said, everyone's focusing on vaccinating the most vulnerable populations right now, healthcare workers and older Californians who are 65 years older and up.
And last night, the state announced it's looking to expand the list of people who will be eligible for the vaccine. There's nothing set in stone right now, but people with a disability or medical conditions could be next in line after some essential workers and older residents. This proposed change would only apply to people vaccinated at hospitals or other clinics where the person's medical status can be verified. Another key thing to keep in mind here is that the proposal didn't specify which disabilities or medical conditions might qualify. All of that is still up in the air.
Some of the ways where we've talked about defining a developmental or high-risk disability would be if an individual is not only likely to develop severe life-threatening illness or death from COVID-19 infection, but that acquiring COVID-19 would limit the individual's ability to receive ongoing care or services vital to their well-being.
So these conversations are expected to take place in the coming days. Also, data shared by state health departments show that those with disabilities are more than 3 times as likely than others to die from COVID-19. Governor Newsom has also said that he wants to simplify the vaccine eligibility by shifting to age-based eligibility, but we haven't heard a lot more details on that. So tonight there are 2 ways that our state is distributing the vaccine, and we have a third one coming up. Right now, it's going to public health agencies and health systems. Next week, the federal government will distribute to select pharmacies.
Yeah, each one is a little different, so let's go through them one by one. First, one is getting the vaccine through public health agencies. Think the community clinic or drive-through vaccine sites that you've heard about or maybe seen on TV for the past month. And we've seen a lot of our counties administer the vaccine in this way. Each county basically gets a specific number of doses through the state, and this is how they administer the shot to you and your neighbors. Now, there are also mass vaccination sites like the ones at Cal Expo or Dodger Stadium. Those are run by the counties, but they can administer obviously a lot more doses than a community clinic or a local pharmacy.
On a bigger scale, but still within the public health agencies, the state and federal governments are working together to start 2 mass vaccination sites. One of these at the Oakland Coliseum and the other at Cal State Los Angeles.
Equity is the call of this moment. The reason this site was chosen was the framework of making sure that communities that are often left behind are not left behind.
These sites in California are just the beginning. We are working in partnership in states across the country to stand up new sites.
These sites will be run by FEMA and California's Office of Emergency Services. They will get their own specific allocation of vaccine doses from the federal government. They're hoping to administer 6,000 doses every day, and they plan to be up and running by February 16th. Californians are urged to sign up with a system called My Turn. This system is set up to notify you when you're eligible to receive the vaccine, and soon you will also be able to make appointments using this system. All right, now to option 2, getting the shot through your healthcare provider. You've probably done this before. Think about maybe a flu shot or other vaccinations. You contact your doctor and you schedule the shot.
Yeah, healthcare providers get their own allocation of the vaccine from the state, and then each one is doing the vaccine appointments a bit differently. Dignity Health asking those to wait to be called, and those with Sutter Health, Kaiser, and UC Davis can make appointments when eligible online. You can call, but just be prepared to wait, sometimes even a long time. As of today, Sutter Health is vaccinating healthcare workers and patients 65 years and older. Kaiser currently prioritizing healthcare workers and long-term care residents. As for UC Davis, that place is focusing on patients 65 years and older, and Dignity Health is vaccinating healthcare workers and those 65 and older.
And finally, option number 3, a major program will be expanding access through some pharmacies. Californians will soon see this launch through some CVS and Rite Aid pharmacies. This is a new incentive announced by the Biden administration this week. About 1 million doses will be distributed to 6,500 select pharmacies across the country every week.
This will provide more sites for people to get vaccinated in their communities, and it's an important component to delivering vaccines equitably. This pharmacy program will expand access in neighborhoods across the country so you can make an appointment and get your shot conveniently and quickly.
And this starts soon. This is a week from today. Select CVS and Rite Aid stores in California will be administering the vaccine. CVS announced it will start these COVID-19 vaccinations at 100 pharmacies across our state. In our area, locations include pharmacies in Modesto and Yuba City. Central Coast locations include pharmacies in Carmel and Monterey. Now, Rite Aid hasn't specifically said how many of its pharmacies will be administering the vaccine, but as the supply increases, more of the retail locations will be added. And as we mentioned, there is some urgency to all of this as new mutations of the virus become more of a threat.
Yeah, health officials are tracking a host of these variants right now, some that are more contagious.
We have to be concerned about the mutants. Viruses will not mutate well if you don't give them the opportunity to replicate in a very large way.
We must take prevention intervention seriously. Now is not the time to let our guard down.
So there are basically 3 main variants right now in California. The 2 West Coast variants are the latest mutations that health officials have been watching closely. The latest update on this is that these variants have been detected in a little over 1,000 cases so far. And then there's the UK strain. That one's been detected in Southern California and the Bay Area. However, the state and country is behind on testing specifically for these variants. So just because the variants haven't been confirmed in other parts of our state doesn't mean that they're not there.
To help us better understand the variants and a host of other issues, Dr. Dean Blumberg with UC Davis Health joins us now live. And let's talk about these variants. How worried should we be? I think the cautionary tale that most of us look at is Britain, where, their hospitals were swamped with these.
Yeah, they were swamped with these, and it appeared that the UK variant is more easily transmissible. And so they found that it's somewhere between 35 and 40% more transmissible, and that probably resulted in an increase in cases. But it can be prevented in the same way, the social distancing and the masking that we're doing for the routine strains. So we feel that we can control it.
So the variants suggest that there's more urgency for these vaccines. So let's kind of take the long view here and talk about what it's going to take to reach this herd immunity that we've been hearing about for almost a year now.
Yeah, so if you take the people who may be immune because they've been previously infected, we probably need somewhere between 70 to 85% of the population vaccinated in order to achieve that herd immunity so that we can go back to not masking and not social distancing and mass gatherings, eating indoors at restaurants, going to religious services and sporting events and concerts.
So as we're looking to get more people vaccinated, Johnson & Johnson now seeking formal approval of their vaccine. This is just one dose. It works in a slightly different way. Is this a game changer?
Well, I think every vaccine manufacturer that we can get on board would be great because then we have more supply. And as you mentioned, the Johnson & Johnson, not only is it one dose, but it's very easy to store. And so this is one that's easily transported to doctors' offices. And so then we don't have to have all these mass vaccination clinics and we can reach a wider proportion of the population.
And as you know, Doctor, soon we're going to see millions of our fellow Californians fully vaccinated. So what happens next in the way of restrictions? What's going to be lifted? And kind of give us an idea of what it's going to look like in the summer and the fall.
Yeah, well, we're really not sure. We're looking to the CDC for guidance on that. Right now, there's no specific guidance that differentiates between what people can do or not do based on vaccination status. But we are seeing some other state health departments starting to relax the guidance for those who are fully vaccinated. So both Colorado and Oregon have relaxed some of their guidance for at least for healthcare workers who've been exposed. So I expect over the next few weeks or months to have some new guidance from the CDC on that.
Dr. Blumberg, I appreciate you weighing in with that because we have heard from viewers who are, on their way to getting full vaccination and still don't know if they can hug their grandkids. So that guidance can't come soon enough. Another thing that has come up for us is viewers wondering to what degree they're going to have to carry their proof of immunization in the future. Are you going to have to use this to get on a plane or go to a concert?
Yeah, I don't know what's going to happen with that. That seems really odd, doesn't it? Like a vaccination passport or something. So I'm not sure what's going to happen with that. And like, let's say if you're fully vaccinated, then do you have to wear a mask in public? And do you trust everybody then who's not wearing a mask in public? I'm not sure how that's going to work.
Yeah, those are some questions that we're just going to have to work through as we get through this time between getting the first vaccination, the second one, and then hopefully getting closer to herd immunity. Yeah, well, we have adapted to a lot. We know we can do it. Dr.
Right.
Blumberg,
thank you so much for your time. And we'll continue this conversation with Dr. Blumberg at 8 o'clock on our KCRA3 Facebook page, and you can ask any questions you have, so we hope you join us for that. Well, when we come back, vaccine fears and hesitancy, what you need to know before you get the shot. Also, the remarkable journey for a Sacramento man after spending 65 days in the hospital. What all of us can learn from him.
Well, we talked earlier about the different ways people can make an appointment and receive the vaccine.
So we thought you'd also be interested in learning more about how states get the vaccine, kind of a behind-the-scenes look. So here we go. Every week, more doses of the vaccine are being sent to states, but how it happens and how states are getting information about that distribution is trickier. States find out how many doses are allocated to them every Tuesday. 2 days later, they're able to order the first doses of the vaccine. Once those orders are in, the shipping starts a few days later.
Second doses are opened up for orders on Sundays, which must be given 3 weeks to 4 weeks after the first one, depending on whether it's the Pfizer vaccine or the Moderna vaccine. And despite the high demand, many are still hesitant to get a shot. They're worried about safety.
KCRA 3's Brian Heap spoke with another of our experts, Dr. Vanessa Walker, to ask some of the most pressing questions we're hearing about the vaccine.
So, Dr. Walker, we know there's a lot of skepticism from people about the vaccine for any number of reasons. And lately, we've seen some stories, and we've reported on them, about people experiencing allergic reactions or even dying shortly after they get the shot. So what is your message to someone who says, see, I told you this thing wasn't safe?
Big message is that really this vaccine is very safe. Those instances that you're reading about are just a handful in millions and millions of people who have been vaccinated.
And you've actually chronicled your own experience with some of the symptoms and the fatigue that you experienced after getting the shot. If you would just tell me once again kind of what you went through and how long all that lasted.
With the first vaccine, almost no symptoms, a little bit of soreness at the arms at the site, but otherwise felt pretty good. The second vaccine was a little rougher. I had about a 24-hour period where I felt kind of like I had the flu. But then it was like the switch was flipped and I felt great the next day with no problems.
And so we've also heard a lot about the vaccine being a challenge to convince people to take, particularly within minority communities. And again, you know, for a host of reasons, not the least of which is just plain a lack of trust in the system sometimes. Have you seen this firsthand with any of your patients, Dr. Walker? And if so, how did you try to ease their fears?
You know, I've seen it firsthand with not only my patients, but friends. I have friends that are people of color, and they're struggling with this all the time. My biggest message to them is that their communities are actually the ones that are being hit the hardest. And so they need it the most, to be honest. Those are the ones that really need to do it. I would give it to my family members. So please save yourself the illness and get the vaccine.
Dr. Walker, are there any people out there, though, who really should not get the vaccine for any number of medical reasons?
People that are have really bad allergies at that baseline, anaphylactic allergies to medications they've taken in the past, or if they have already had one of the doses of the vaccine and had a very severe allergic reaction, should probably not get the second dose. There's one question that a lot of people are asking about the vaccine that people are really concerned about is, will this vaccine affect my DNA? That's something I want to make sure that everybody understands. That is not going to happen. This vaccine contains basically the blueprint for creating what's called a spike protein from the coronavirus. So it's just going to teach your cells how to make it, and then you're going to be able to create antibodies against it. And once it's done its job, it basically gets dissolved in your system, and it's not going to be there forever. So this vaccine does not interact with your DNA or affect your DNA at all.
What do you think is going to be the best strategy for the state moving forward to try to overcome some of these fears that people have and perhaps change their minds and get them to take the vaccine?
I think continuing to shine light on the successes, how many people are getting the vaccine, how minimal their side effects are. That's really what's going to win the day. Just shining a light on everything and not, hiding anything. I've tried to do that with my vlogs to show everybody what it's like to get it. And I know other people are doing the same.
And we still really don't know the long-term effects that COVID-19 has on the body, and especially for those who were hospitalized for weeks or even months.
Lisa Gonzalez checked in with a Sacramento man who was hospitalized for 65 days. She has more on his long recovery back to being himself and the one thing he wants to do once it's safe.
Right now I feel very well. I would say that other than my voice, I'm back to 100% normal.
Paul Cantelli is thankful to be able to walk around his East Sacramento neighborhood. It's been nearly a year since he was hospitalized with COVID-19.
It's been a long recovery, that's for sure.
Paul was taken to the doctor on March 25th after noticing a drastic drop in blood oxygen. He didn't even know he had COVID.
And after I went in the hospital, I was out of it on a lot of medications, so I wasn't even awake until sometime in May.
After 65 days in the hospital, 40 of them on a ventilator, Paul then began the second leg of his journey, rehab.
I couldn't walk before, I couldn't open a bottle of water. I wasn't going to give up, and I was going to do whatever it took to get to this stage.
After beating COVID, Paul still faced months of recovery and rehab just to get to this point.
I get winded quicker than I used to. They're saying there's no damage to my lungs, surprisingly, at this moment. Everything considered, I'm very blessed to where I'm at right now. The doctors and nurses did an unbelievable job in what they had to do in taking care of me all that time. And, I don't know how else to shed any light on that. It's because of them and prayers I'm here, right?
Now, 8 months into his recovery, Paul is looking forward to one thing.
I want to get on a plane and see my family. My mom, my sisters, my kids, my grandkids. I'd say that's number one on the list.
Paul is waiting to get the COVID-19 vaccine to protect his family. And in the meantime, he is giving messages of hope to others currently battling the virus.
Don't give up. Keep praying. Stay with it.
In Sacramento, Lisa Gonzalez, KCRA 3 News.
A lot of families going through similar situations.
Yeah, I was just thinking that. Well, still ahead, looking out for one another, the important first step you can take tonight and the major positive people can take from the pandemic.
For so many people, this past year of the pandemic has been tough.
Yeah, millions losing their jobs, students having to do school from home, and families just not able to see each other. Our world shifted in an instant, and it has created a lot of stress and anxiety. But you can help your loved one or a friend. Dr. Angela Drake, a psychiatrist with UC Davis Health, explains the idea of post-traumatic growth.
It's almost like you're turning this idea of stress on its head and saying that I can grow from this. But you would be surprised when you do start asking people about their experiences in the pandemic, they will say things like, boy, I've realized how much my family really is important to me. Or I realize that, work is only work. And that my friends are really, critical to my life. So, again, that's the idea of post-traumatic growth, is where you focus on the things that maybe have come out of the pandemic, which are positive.
Well, some perspective to keep in mind, and hopefully what will be the waning months of this pandemic.
Before we go tonight, I want to quickly share some resources. We have the latest information on our KCRA3 app. You'll find a lot of links with more information.
And a reminder, join Brian Heap and Dr. Dean Blunberg to answer your questions on our KCRA3 Facebook Live. That's starting up in a couple of minutes.
Thanks for joining us.